Hi, everyone. Thank you so much for joining. We are lucky to have you here at the Collaborative Mentoring Webinar Series, and thank you for joining us today. So today we'll be talking about mentoring and supporting young people's mental health and well-being. So my name is Annabelle Hernandez, and I'll be facilitating today's conversation. Let's get started. So before we do, I just want to share some housekeeping information. Given the size of our audience today, all attendees should be muted for best sound quality. So in 1 week, you'll receive an email with the information about how to download these slides, as well as the webinar recording. You can also access the information directly by going to Mentor's website in the next week. So in order to continue to improve the series, a short survey will also pop up as you exit the webinar. Please just take about 3 minutes to give us your feedback. And so I do again want to thank everyone for joining our webinar. We're happy to have you, and we'll be discussing again the ways that mentoring programs and mentors can support young people and their mental health, and strategies for facilitating these conversations around trauma and mental health, especially during this time where young people, and honestly the entire world, including ourselves, are experiencing a great deal of heightened stress and anxiety that can take a huge toll on our mental and emotional health. So in doing so, we're going to be covering a couple of key questions for today's webinar, and one of them is, what is the role of mentoring in supporting mental health and well-being? What approaches and best practices does your program have to address and facilitate conversations around mental health and well-being? How do you train mentors and staff to be trauma-informed, and what exactly does that look like? And how do you prioritize and practice self-care for mentors and staff, as well as how do you acknowledge the collective trauma we are currently experiencing together, and what can mentors and mentoring programs do during this time to support young people as well as take care of each other. So I just want to go ahead and move along, quickly introduce myself. So I am, again, my name is Annabelle, and I'm fortunate enough to be a member of the 2019-2020 cohort of Youth Advocates for Mentoring. My passion for advocacy really started in working at a non-for-profit in the community where I grew up in, which is also an inner city community in Chicago. And there I just learned the struggles of families. And in doing that, I learned how much I want to advocate for them and give them a voice, as many of them feel that they don't. So I do hope to create more opportunities in the city that enable these youth to become leaders of their own and want to also make that change. So I'm happy to be a part of this webinar, and I would like to, go ahead and just keep moving along. So we want to, for those panelists, we do want this to be a participatory experience, so please just use the question box to ask questions throughout the webinar. Mini Chen will be queuing up questions to share with panelists during the Q&A portion of the webinar. We may not get to all questions because there are several hundred of you on the webinar who have registered, but we will do our best. The questions that we share with the panelists are generally ones that are brought in or to deepen the conversation. First, to get a sense of who is with us today, we have 2 short polls. So the first poll is, what is your experience level in the mentoring field? And so you can select beginner, experienced, expert. Just take a couple seconds to fill this out. Okay, perfect. And now let's move along to, okay, so we see that a lot of people are experienced, which is good. And I think that this webinar will kind of provide us with information for everybody in pulled in the different areas. So our second poll is, what is your role in a mentoring field? Okay, I think that gives us enough time. Okay, perfect. Let's see, there are a lot of practitioners on today. Okay, so we want to welcome everyone and thank you again, and we hope that today's information will be applicable to everyone on the line, no matter what polled. We want to go ahead and introduce our first panelist, Hilda Marie. So So you can move along there. Perfect. So Hilda Marie is the program director at Vibrant Emotional Health in New York City. She oversees the emotional wellness services offered to the young men of the Fellowship Initiative, an academic success and leadership program for young men of color. Hilda is also a certified youth and adult mental health first aid instructor, as well as an interfaith minister and consultant for multiple social service organizations throughout New York City. I want to go ahead.
Great. Thank you for that introduction, Annabelle. And hello, everybody. I'm excited to be part of today's work. So a little bit about who I am and what I do before we get into this very important conversation about trauma, mental illness. And it's kind of going to be a twofold conversation because I'll be focusing on how these impact youth, but also how they impact us, the people who are supporting youth. And just to give you a bit of background, I'm privileged to work with a program called the Fellowship Initiative. My organization is named Vibrant Emotional Health. And for those of you who are local to New York, you may know us as the Mental Health Association of New York City. And we recently changed our name because we wanted to convey through our name the message that we can live with mental illness and we can have we can thrive and have successful and rich lives, vibrant lives, despite struggling with a mental illness. One of the roles that I play at Vibrant is as the emotional support person for the youth in a program called the Fellowship Initiative, funded by JP Morgan Chase. And the Fellowship Initiative provides emotional support, referrals, resources to young men of color who are in an intensive academic prep program that will prepare them for college life. Although my work is specific to young men of color, and that's kind of my specialty, I do have 23 previous years of experience working with young women in rape crisis and dating violence and domestic violence. And so I will speak to youth in general today. What drives the work that I do at Vibrant? One is a scary statistic, the first fact on your screen, which is that suicide is the second leading cause of death for people who are aged 10 to 34 in the US. That tells me that a lot of young people are dying, and they're dying unnecessarily. They're dying because they're in a state of despair. And what we want to convey to young people is that despair is an experience. It might be a moment, it might be a series of moments or a prolonged period, but it's not forever. And so we want to point young people towards hope by supporting them and by giving them the resources that they need in order to cope with stressful circumstances. We know that certainly mental illness and trauma are two factors that can really be conducive to a young person contemplating ending their life through suicide. And so, again, this is just something that's a very, very personal cause for me. When we look at the numbers on anxiety and depression, as far as it pertains to youth, nearly 1 in 3 of all adolescents from the age of 13 to 18 are going to experience an anxiety disorder. So when we think about anxiety, I want to talk a little bit about typical anxiety and then anxiety that we should be concerned about with youth. So for example, being worried about exams is a typical anxiety. Being self-conscious as an adolescent or worrying about dating or going out in a social setting and making a blunder or how you're perceived, those are normal anxiety levels for youth. When we talk about anxiety disorders, we're talking about a youth who doesn't lose a night of sleep over an exam, but is losing nights and months worth of sleep because of exams or fear of failure at school. Or a youth who is not leaving their home to socialize with peers because they're so self-conscious or afraid of being embarrassed or making mistakes. So always think about extremes. Anxiety is normal. We all experience it, as with depression. But when it begins to impact academic and relationships, social life, family life, we start to look at all these areas that become impacted. And that's when we can really say, maybe this needs a little bit further exploration, or maybe this is a deeper issue than we first thought. I'll show the statistic on depression, which is that 20% of adolescents experience depression before becoming adults. So I'm going to move to the next slide because I want to give you sort of a visual of what these numbers actually represent. If you were in a classroom with 100 freshmen, right, let's say intro to Psych 101 classroom at college, 20 out of those 100 potentially might have depression, and 33 out of those 100 might have an anxiety disorder. And we don't know how many of them might have a combination of both, which we call coexisting or co-occurring disorders. We can move to the next slide. So when we talk about trauma, we know that it's an emotional response to an event that we perceive as threatening to our safety, potentially to our lives. It can be emotionally threatening as well. And when we think about children, we really have to pause and ask ourselves, what does a child consider traumatic? And so that's a question that I ask of you. What are events that might be traumatic to a child or a youth, a young person, that perhaps for adults we may not even think about those? So if you could just take a moment to answer that question. What are some events or to think about that question. And when we think about trauma, it's really important to think about things that perhaps we don't often consider. For example, the immigration and acculturation experience for youth, or foster care placement, natural disasters like Hurricane Maria. But youth may also experience other life events as traumatic: a breakup, separation from a parent, an absent parent. Maybe they're emotionally distant as opposed to physically distant. So it's really important for us to not define for youth what trauma is, but to allow them to tell us what they can consider to be traumatic. When we talk about complex trauma, we're talking about multiple exposure, multiple events in a child's life that are traumatic. And this is often the case with child abuse, sexual abuse. In war-torn countries, children are exposed repeatedly to very devastating effects that really feel invasive. And over time, these effects multiply and continue to impact young people throughout their youth and much later into life, in their relationships, in their feeling of safety in the world, in their ability to cope with stress. Just a little bit of history on trauma and complex trauma. We can move to the next slide. When we talk about a collective trauma, Annabelle highlighted that. She shared that right now the world is in a state of collective trauma. And what that is, it's a psychological reaction to a traumatic event. And needless to say, as we face this sort of new threat to our safety that's posed by COVID-19, the world is in a state of uncertainty, fear, grief. Economically, people are being challenged. And so a combination of these factors creates a state of trauma for multiple people. It can be of a group of any size. Sometimes we hear about collective trauma as historical, cultural, or ancestral trauma. So when we think about slavery, when we think about the impact of natural disasters on large communities, when we think about the Holocaust, even if individuals do not live through those experiences generationally, the impact of that trauma continues to harm people. We have then the trauma that would pertain to professionals like yourself who are supporting people who might be in crisis or have experienced trauma. We know that to be vicarious trauma. We don't have to necessarily have experienced a trauma ourselves, but we are impacted by repeatedly hearing the stories and the accounts from others about trauma. You'll have to forgive me, that's my puppy in the background. We also know this type of trauma as compassion fatigue. And this is where, we're going to spend a little bit of time talking about how we can support mentors so that they know and recognize when they're experiencing this type of trauma and some things that they can do to address it. We can move to the next slide. When we think about youth and their exposure to trauma and to mental illness, there are certain things that put young people at risk for mental illness, and then there are things that can actually protect them and almost serve as a shield. When we think about homes in which a youth may have an abusive parent or a parent who's using substances, we're immediately looking at a young person who's at a higher risk for suffering from mental illness through potentially the neglect of their needs, of their emotional and physical and material needs, as well as actual traumatic abuse, physical, sexual, and all manner of abuse. Also, young people who are isolated. And so when we think about isolation in the world right now, that's just about everybody in a sense, as we have to pull away from the supports and the people and the places that we're accustomed to turning to for guidance, for solace. And poverty certainly puts young people at risk through lack of resources, through lack of exposure to services. And there are multiple other factors that potentially you can think of as well. However, when we look at protective factors, that's where you come in as mentors. You are a protective factor in the life of a young person. Through your support, through your guidance, through your presence, you create a safe space. You support youth in becoming more resilient. You potentially take up some of the spaces of the people in their lives who are absent or haven't been there in the ways that they need. And so I just want to stress and highlight how important your role is in protecting young people from mental illness. Other protective factors are having a parent who's present and nurturing and involved. Young people are highly resilient, and some people are more resilient, obviously, than others, but resilience can be built, can be encouraged, can be supported. And so that's something that we can definitely work with young people. And just having some stability at home in terms of finances and strong, loving support systems around them can definitely protect youth from being exposed to mental illness, as well as substance use and the suicidal ideation or thoughts. We can move on to the next slide. So, in talking to youth about mental health and trauma, how equipped are we? Certainly, these conversations aren't easy, and they require a set of skills or a certain confidence level or an open door for us to kind of move through. And we know that particularly with adolescents, they tend to be really protective of their privacy and may not share or expose so much about themselves. And so this is really in a nutshell, but we're gonna talk about some ways that you can open up conversations that will help you talk about these experiences. I just want to highlight that our role as mentors is not to resolve these experiences for youth. It's not to be a therapist. It's not to overstep in terms of our own capacity to help and support others. I think of us more as a bridge, as that link or that connection to the proper resources and supports. And I've shared various resources that will be included in your slides that are absolutely helpful, including the National Suicide Prevention Lifeline, the Disaster Distress Helpline, which can support people right now as they're going through the pandemic, and various other resources that I hope will be helpful to you. So let's move forward with the next slide. When we're talking to youth about mental health and trauma, we have to understand that a safe space is the building block for everything else. And part of, or one of those major building blocks is trust. Trust, however, especially with young people who have been exposed to traumatic events, trust can be something that takes a long time to build up. With youth, I find that starting really gentle and slow and allowing them to gradually build up their level of trust always makes for a safer relationship. What I do find often is that some youth will come into a mentoring experience. Perhaps they're not accustomed to having an adult who has, who's giving them their full attention and time. And they may reveal of themselves or share too much. And as a result, they then feel very vulnerable or exposed and will pull back. And so I always encourage mentors or anyone working with young people to pace it, to give young people permission to talk at a time and in a place and in a way that's comfortable for them, especially if you're in group settings, because overexposure too soon tends to cause sometimes this pushback as they think about whether they perhaps said too much or we're going to think about them differently because of what they shared. So just allow those things to go at their pace. Also, young people express emotions perhaps very differently than adults. Working with young men, I know that one of the emotions that sort of traditionally, historically, we've accepted as a form of expression from males is anger, right? And so sometimes a youth that's exhibiting a lot of anger, aggression, pushing back is actually a youth who might be depressed or experiencing a deeper sadness, but doesn't have permission to express that. And so especially in working with young men, with boys, I highly encourage you to allow spaces for them to talk about their feelings. Stay in touch with what's happening in the world. Sometimes I'll come in with a topic such as trauma, let's talk about trauma. Nobody wants to say a thing in the group setting that I'm in. But then I'll mention something that happened that's been all over the news, a case of police brutality or something pertaining, very specifically to youth and their world. And then suddenly the topic is real, the topic is hot, and we want to talk and we want to share. So just stay abreast of what's going on in their world and ask probing questions. Sometimes you tend to answer with a yes or a no or a ha or a whatever. And so it's always good to delve a little bit deeper. Sometimes those are almost a test of whether we will search or explore a little bit further or whether we'll be deterred by their responses. And so I always ask a little bit more. I'll say, well, I'd love to get to know a little bit more about you. If you had to share one thing that's really important about you for me to know, what would that be? Why is that important? And then, sort of generating more questions and conversations from there. We can move to the next slide. There are messages that young people need to hear from us, but I think all of us need to hear from each other, no matter our ages. One of the things I like to remind young people is that they are resilient, that they've gone through difficult experiences and have survived them, and that they have the tools. And if they don't have those tools can be learned and acquired with the right support to get through difficult times. And one of the biggest tools that we can give youth is teaching them how to ask for help, teaching them how to say, I'm hurting, I need some support. Okay, not needing or feeling like they have to be self-reliant. A lot of youth are under so much pressure. When I think about the young people I work with now and myself, as a kid, 40 something years ago, I realize how overscheduled young people are and how driven they are and how full their lives are. And sometimes their worth comes down, or they feel like their worth comes down to a grade or a GPA, a grade point average. And it's just important to highlight that they're good enough as they are. They don't need to be more. I'm happy just being in your company. I'm happy with you just showing up and being you. Giving them permission for that really opens the door to safety. A couple of other things. You don't need to be perfect, and it's okay to make mistakes in our relationship, in our mentor-mentee relationship, but in life, because those are learning experiences, not failures. We talk a lot about reframing with youth and really helping them to see their life experiences in a different perspective. And one of the things we know about youth is that sometimes their sense of time is really different than adults. And so if they're immersed in a difficult moment, a breakup, a negative experience at school, or a fight with a parental figure or caretaker, it feels like it's going to last forever. That moment feels all consuming. And so always highlighting that even though things are difficult now, it's going to pass. You can move forward. And particularly when youth are feeling suicidal, we don't want to minimize that, or the reasons that got them to that space. But we also want to highlight, with the right support and with the right people, we can help you get to a better space. You won't be in this painful space forever. We can move to the next slide. Thanks. And so when you are sort of the container for these conversations, for the sharing that youth will do with you, eventually, as a helper, as a support person in the lives of youth, we may start to experience symptoms that are related to the trauma that we're hearing you share about, or the challenges in their world. And so I just want us all to be aware of what are the signs, not of burnout. We're not talking about burnout. I'm talking about vicarious trauma and how it can emotionally and physically start to drain you. So a lot of people may find themselves becoming irritable or snapping or just becoming very cynical about the world, hopeless sometimes. Sometimes you might experience fears and anxiety that are not relevant to your world or your situation, but are very much related to the stories that you're hearing about from our young people. Sometimes it causes us to disconnect and to just want to check out. And sometimes that leads to behaviors that can be damaging, such as perhaps drinking too much, or sleeping, or overeating, or doing or practicing coping strategies that are not healthy or supportive to us. Sometimes we feel guilty that we have what we have and that the young people we care about are struggling and facing so many challenges, and we don't know how to change that. And often we develop a high emotional sensitivity to hearing about pain. And so, for example, I currently can't watch the news. I know it's important to watch them, but I'm oversaturated listening to stories of people's struggles as they deal with the pandemic and losses and grief. And so I know that I couldn't potentially, sit and listen to the news for an hour and take in any more of that, because I might crack. I might, have my moments of despair. So let's look at some of the physical symptoms of vicarious trauma. And these aren't always obvious. We don't always know that physically we're going through some challenges that are related to the trauma in our world, but we might start having trouble sleeping or sleeping too much. Often when you have vacation or a couple days off, you end up sick. It's almost like your body is saying, whew, finally I can take a rest, I can shut down. I've been carrying this. And so people often find themselves sick on vacation or on their days off. Sometimes you'll rest or nap or try to find ways to recoup and yet feel tired no matter how much you rest, and that's a big red flag. And our bodies can contain all kinds of discomfort and pain, and often that manifests in our spine and our neck and headaches, stomach aches, just as with young people. So everything that I'm talking about here as symptoms of vicarious trauma and emotional trauma are also symptoms that young people might experience. And we'll go to our final slide and talk a little bit about self-care for mentors. And obviously, as I said, this is Trauma 101 and self-care for mentors in a nutshell. My contact information will be available in the slide, and I'd be happy to address any personal questions that you might have. So it's really important to create spaces to take care of ourselves, to set healthy boundaries, even with our mentees. So one of the challenges I often have in working with young people is that they operate on a different time frame. And so I'll get texts at midnight or 3 in the morning when they're up and bright-eyed. But that begins to impact my own sleep schedule, my own health, my own relationships, because I'm distracted at all hours. It's really important to set some guidelines and sort of a containing space around how much time and when and what is appropriate in terms of the time that you spend communicating with your mentee. I always suggest that if you don't have the answers, let's say you're dealing with a young person and they've divulged a history of physical abuse and trauma, and you don't quite know what to do, seek support from the experts. Even the young men in my program are able to call the National Suicide Prevention Lifeline and have them all memorize the number. And they've called and said, I have a friend who's struggling. How do I manage this? And they will actually guide and walk them through next steps, or support them in understanding whether this is sort of a kind of a I'm going to use quote unquote the word normal response to stress, or whether this person is really in crisis and requires crisis intervention. So whenever in doubt, I think it's so important to just reach out to other professionals, bring them in as guest speakers, create opportunities for parents and youth to be part of trainings and experiential sessions and opportunities to really talk and practice through these skills. I also encourage mentors to start their own support groups. Right now, with everybody doing Zoom meetings online, it's really relatively simple to gather like-minded people, develop a structure, and have a safe space to talk about the challenges of mentoring. And as a last tip, I'll say, use your humor when appropriate. Sometimes we just have to laugh, not at, obviously, the situation, but we can find moments of joy and lightness and humor, and young people need that as well, especially the more profound, the more complex their lives are. I have found that creating space for fun, for lighthearted activities, for interactions that are not loaded with conversations about mental illness, trauma, and challenges, they need that too. So I'd be happy to answer any questions towards the end of the webinar. Thank you for your time.
Thank you so much, Hilda. I now want to go ahead and introduce our second panelist, Jameson Merrill. He's the Chief Program Officer at Up to Us Sports, where he oversees program design, monitoring, and evaluation of Up to Us Sports national coach and training programs. He's currently the co-principal investigator of a Department of Health and Human Services funded study of Up to Us Sports school-based programs in New Orleans. Jameson previously held a junior faculty position at Johns Hopkins University School of Public Health and spent several years doing global adolescent health work in sub-Saharan Africa, Asia, and South America. He holds a Master's of Science in Public Health from the London School of Hygiene and Tropical Medicine.
Thanks so much, Annabelle, and thank you, Hilda. Hi, everyone. I'm excited to speak with you all today, and it's impressive that we have 995 attendees currently. Thank you all for joining, and we look forward to hearing more about your experiences. Today, I'm going to give you an overview of the work that we do here at Up to Us Sports. We are a national nonprofit organization whose mission is to recruit, train, and support sports coaches. So we really view mentoring through sport, and the coaches are our mentors. And the coaches to inspire youth programs in their communities. Our vision is that all youth have a coach who is trained to help them achieve their potential in life. Next slide, please. So I'm going to talk about two different programs that we have. Our Up to Us Coach program, which is the only national service program for coaches. And when I say service, I'm referencing AmeriCorps. Since 2010, we've placed 2,800 AmeriCorps coaches to expand sports opportunities in 20 U.S. cities. We've engaged more than 200 at-risk youth through year-round sports and positive youth development programming. And then our other program is through training of coaches who might not be just our AmeriCorps volunteers. And since 2010, we've trained more than 22,000 coaches across the country. Next slide, please. So this just gives you a little sense of our reach. I wanted to show you this so you might you might be able to relate to some of the locations that we are in. We are headquartered in New York City and have offices in Philly and Baltimore, Miami, New Orleans, Chicago, Los Angeles, the Bay Area, and Seattle. Next slide, please. So now that you know a little bit more about the background of our organization, I also wanted to provide a background of how we think about mental health at Up to Us Sports. Pre-COVID, we definitely thought of mental health as it relates to adverse childhood experiences, which as many of you probably know, encompass abuse, neglect, household dysfunction, and we know that ACEs, as they're often referred to, are prevalent, with over half of adults reporting more than one ACE, and 1 in 6 reporting more than 4 ACEs. And ACEs can have really long-lasting negative consequences on health. So heart disease, obesity, stroke. But for this conversation today, specifically depression. Actually, people who experience 4 or more ACEs have 4 times the odds of being depressed than those who did not. And as Hilda already referred to this, but half of all mental illness occurs before a person turns 14 years old, and 3/4 of mental illness begin before the age of 24. So through our program, we are really targeting youth, ages, children to older adolescents, and our coaches are in that 18 to 24 age range. So definitely trying to, intervene early with some of these age groups. But now we know that we can't just think pre-COVID. So in addition of continuing to think about adverse childhood experiences, we also know that right now young people are at an increased risk of stress, anxiety, and other mental and physical health issues. And now we're getting in data that can kind of support that assumption. So a recent study from The Lancet showed that kids who were quarantined were 4 times more likely to show signs of PTSD than those who were not. We know that we're facing an economic challenge as well, and these downturns are associated with increased mental health problems for youth due to trickle-down effects from adult unemployment, adult mental health, and child maltreatment. A recent Kaiser Family Foundation poll suggested that nearly half of Americans feel that COVID-19 has harmed their mental health in some way. And then we can also look at other epidemics that happened in the past. And relatedly, the SARS epidemic in early 2000s showed increases in PTSD, stress, and psychological distress in people. So now we know there's even more work to do during and after. Next slide, please. So I wanted to quickly talk through some guiding principles that we have as an organization. And generally speaking, we know from the mentoring field, we've learned that a caring adult is one of the most critical ingredients to fostering goal setting and achievement. And also a caring adult is associated with significant increases in a young person's ability to cope with stress and trauma. And so with that in mind, I wanted to outline some guiding principles that we have to kind of inform our work, to keep us grounded in what we do. And so we believe that mental and physical health are 2 sides of the same coin. Obviously, we are a sport and physical activity organization that is attempting to improve mental health outcomes of young people. And the explanation for the impact of sport on mental health is kind of twofold: chemical and behavioral. So sport and exercise reduces the body's stress hormones, cortisol and adrenaline, and it also has numerous emotional benefits that can boost mental health. So you might gain mastery of a new skill or improve your self-image and confidence through practice and achievement through sport. The next guiding principle is that our coaches play a pivotal role in maintaining and cultivating positive mental health for young people. But importantly, we feel that positive mental health of coaches is a prerequisite for positive mental health of youth. And we'll talk more about that in a little bit. And then finally, relationships founded on mutual respect, trust, and praise help buffer stress and trauma for young people. Okay, next slide, please. So just wanted to provide a little bit more data to support those guiding principles. So as I referenced, sport is a powerful healer and provides an important protective barrier for children and young people. A 2019 study found that youth who participated in team sports were less likely to develop symptoms of depression later in life than those who did not play team sports. And we know the positive effects, as I've already referenced, from having a caring adult mentor. It's been strongly linked with reduction in depression symptoms for young people, and the presence of a caring adult is the main factor in building resilience. Next slide, please. So as I alluded to, coach mental health is a prerequisite for youth mental health. And at Up to Us Sports, we really prioritize coach wellness. And we do this, and this is a very simplified theory of change at the top. We always start kind of the pathway. It always starts with coaches for us. And we do that by providing them with structured training and support on the importance of self-care, reflection, and debriefing. As Hilda spoke to on vicarious trauma, we know that there are symptoms that our mentors or coaches are experiencing, and these are things that we do to help them through some of those experiences. In addition to what Hilda said, we also kind of leverage exercise and build in group reflection and debriefing. Next slide, please. Now we are definitely, as an organization, experiencing more communication of mental health issues within our coaching cohort. And so right now we're working really hard to refine our referral protocols for coaches who need support with mental health issues. During COVID-19, AmeriCorps is providing free counseling for its volunteers through All One Health, and we're working actively to try and link our coaches to services that they need during this time. Next slide, please. So we talked about the importance of coach wellness, and now I'm going to give a little bit more information about our coach training. So we developed the first coach certification in sports-based youth development, and it involves 50 hours of training for our coaches, who are then placed in community-based organizations throughout the country. Our coach training involves providing coaches with trauma-informed skills and strategies to help them engage kids who are experiencing these adverse childhood experiences. And more specifically, our trauma-informed content provides coaches with an understanding of how stress and trauma affect the brain of their players or mentees, how personal and community context affects the behaviors of their players, and how to leverage trust-based relationships in sport to improve wellness and build self-efficacy and confidence. And I'll talk a little bit more about the strategies coming up here. So next slide, please. So when we think about strategies, and for this conversation, wanted to simplify some of the things we do into two kind of categories of kind of trauma-informed strategies that our coaches can then employ with their players and teams. So we have kind of the environment, or the environmental strategies, and we have the individual strategies. So at the environmental strategies, we have things like building safe space, which Hilda already referred to, and then also building a positive team culture. So once a safe space is established, sports or a team really offers a great setting to establish and learn new traditions and rituals, such as even handshakes or celebrations, and those types of rituals have a power to create, long-lasting connections, connections that these young people might be really seeking. And we really believe that these rituals and culture is kind of like the mortar that holds things together for young people. So in addition to this carrying it all relationship, it's these intentional things that they do that really maintain young people's interest in the activity and get them feeling better about what they're experiencing maybe outside of the team. As far as individual level strategies, I really wanted to highlight what we call listening skills. And I really think about it as active observation. So you might be asking, what are you looking and listening for? I think you would be looking for baseline behaviors. So what is their version of normal? We want to use look and listening skills to learn the stories of young people and then design intentional approaches that lead to outcomes. And that really leads to this next strategy, which is coaching for outcomes. So once we have that baseline, we can then design practices that can reach the ideal outcomes that we want for youth. So if we know how they learn, if we know what makes them feel good, what makes them shut down, we can better design those practices. And finally, praise. And praise, as a lot of us probably already know, builds self-efficacy and confidence, and it creates a feeling of belonging between you and the players and the team. And the more specific the praise, the better. So we say specific praise allows for youth to better replicate the behavior. We really want behavior we really want them to know what they did and how they continue to do those things moving forward. And we focus on the behavior because that's what we see and hear. And when coaches focus on behavior, we help athletes continue to do those things over and over again. Next slide, please. So real quickly, I also just wanted to speak to what the role of Up to Us sports coaches will be moving forward kind of during and post-COVID-19. So as a service organization and a mentoring organization, we really see the opportunity that we have to address some of the needs that our youth and communities will be needing. we know that there's a youth unemployment crisis right now, and through service, up to us sports coaches can aid healing for themselves, youth, and communities by serving as community health coaches. We're really thinking, we're in a phase of first response right now where people are trying to meet their basic needs. But with these other crises appearing, mental health, unemployment, people are going to need these second responders and like all of you on the line right now, mentors to help people cope and heal after this. And finally, we're thinking about how we need to rethink safe play, sport, and mentoring, and coupling that with tailored coach-based mental health approaches. And these are some questions that we're starting to discuss and plan for. And most importantly, what are the new skills that we can give our coaches to better support their players' mental health, knowing all that we know now, from COVID-19 and the data that I spoke to previously. So these are just some of the ways that we're thinking the roles that are up to us sports coaches can play post-COVID. Next slide, please. I also wanted to just call out a few resources that we have. At our website, we launched an Up to Us Sports at Home platform, which you would, if you go there, you'll find one-pagers on trauma-informed coaching strategies, videos on self-care from our coaches throughout the country, and many other useful documents at this time. We have a Keep Girls in Sport digital training curriculum, which is open source and can give you a sense of the types of training that we do for our coaches, accessible through that link. And then finally, we have an opportunity through AmeriCorps at the national level, and we are placing currently no-cost VISTA positions to interested organizations. I've included the link for anyone who would like to apply, and the more information would be given to you once you apply. But yeah, this is an opportunity for organizations to host 9-week VISTA positions. I believe that's the end of my presentation, and now we're ready for some question and answer.
Thank you so much, Jameson. So yeah, as we mentioned, we want to go ahead and transition into our Q&A. Just what are some questions we have for?
Thank you, Annabelle. So we have definitely a lot of questions coming in. I think the first one, and you all might have touched upon this already, is if you guys can share more about how or ways you have seen either through your programs or just other programs supporting the well-being of young people virtually during this time, how to support mentee mental health with limitations of virtual programming. So if you want to share any ways that your organization.
I'd be happy to share, Minnie. So in my experience, I have found that you've continued to reply more to text messages and to use that medium for communication than any of my attempts to have Zoom meetings or sessions. And even when we do video calls, I find that they'll place a blank spot in the room or, not include their faces in the video call. Sorry about that, ringing phones. So I continue to use that as a medium because I feel like it's one that they're more responsive to, and my experiences have not.
Hi, Hilda. I think we may have lost you for a little bit. Are you still there? I apologize. I turned off your video since I think there was a bit of a lag.
Yes, my apologies. I was sharing that in my experiences, youth have not been so responsive to video calls and have been much more receptive to continuing to communicate via text. And so I've used that as the more common medium for sharing resources, for communicating with youth and parents.
Great. Thank you so much, Hilda. Do any of the other presenters want to talk a little bit more about what's kind of the best way to keep mentees connected virtually?
Yeah, I think I can speak to some of the success that our coaches and partner organizations have had throughout the country. So I think we're in a unique position where we have a draw. We can draw people in, and the hook is always sport. And so we've had some of our coaches throughout the country have had a lot of success in organizing virtual practices and workouts. I think that they have then used those workouts as a vehicle for social emotional check-ins and maybe more consistent, mentoring type conversations. And so I think, one thing to consider is potentially how to build in things like play and fun into the check-ins that you have with your mentees. I've heard even of other organizations using gaming, and I think just trying to find ways to make it relevant, make it fun, because of course a lot of us are also experiencing some fatigue at this moment with video conferencing, and so I think that's just a couple other ideas from kind of the Up to Us Sports perspective.
Great, thanks so much, Jameson. So a few other questions on just kind of the piece of how do you also engage young people and their families in conversations about mental health. I know we talked a little bit about Hilda earlier. You mentioned kind of how to approach young people and kind of really facilitating some of these conversations. But I know lots of families and folks come from different backgrounds and have different understandings and views on mental health. So kind of how do you really open up and make sure families are involved in those conversations as well?
Thank you, Minnie. It's really a balance of helping parents to kind of see the difference between what are typical adolescent emotional responses to stressors or to life, and then what might be of concern. And so I often try to normalize. So it's common for teenagers to have perhaps fluctuations in mood or to want to be autonomous and develop their own identity. And so they may not be talking to parents as much, but they might be more receptive to talking to another person about their concerns. And I also ask parents, what they observe, because those are things that you kind of can't argue against. So if a parent is saying, well, my child is sleeping all the time, or their door is always closed and they're always isolated, or their mood has become really irritable and it's starting to show up, in arguments with their peers, or their academics have declined. So I ask a lot of questions which almost answer the concern. So you can then reflect back and say, so it looks like what's happening with your child is an escalation of what you've seen in the past, or is starting to impact multiple areas of their lives. Do you know about supports in your community? What do you know? What are your concerns or even fears about reaching out for help? And very often when you open the door, parents will share things like, I'm afraid if my child gets mental health services, they won't qualify for college because it'll show up on their records somehow. Other parents have said, my child wants to be in the military, and if they have a mental illness, they may not be eligible, or the police force someday. And so being able to kind of talk through those fears and alleviate some of those and reassure them that, typically youth are struggling with depression, anxiety, and those are normal responses to abnormal circumstances. I find that usually helps to minimize, sort of their concerns about getting help. I also try to make parents very much a part of the decision making, calling together, supporting them and asking the right questions, and seeking for culturally competent providers is really critical. And if you think about, for example, working with immigrant families, there's a lot of fears in that community right now. And so you want to ensure that there's some sense of safety and that there won't be repercussions for those individuals if they seek outside sources or involve outside sources.
Thank you so much, Hilda. We have another question here. I think this is geared towards Jameson, but also I think Hilda could also speak to this, just kind of wondering more about your training for your coaches and the kind of the trauma-informed approach, and how you also kind of integrate racial equity training in that, as we know that trauma can also be deeply tied to a systemic inequities that exist.
Yes, exactly. Yeah, no, it's a really good question, and something that we're actually building out through a partnership with Rise. They're based out of Detroit and New York City, and we're looking actively to build out our race, equity, and inclusion content. from that perspective, we are very intentional about the recruitment of our mentors. For example, this year, 72% of our mentors are coming from the communities where they are serving. We feel that's very important and something that we prioritize with our community-based partners. So that's one way that we are addressing that. And then through our trauma-informed training, we are actually looking to build out some more of that race and equity content kind of as we speak right now. So very good question, and more to come on that.
Yeah, thank you, Jameson. That's a great response. I would add to that with the fellowship initiative, again, funded through JP Morgan Chase, because we specifically work with young men of color and families of color, we are really creating spaces to talk about the wounds that these communities have experienced, to acknowledge that the struggles are real, have been real, and continue to be real, and that they impact the quality of daily life, and allowing spaces to talk about the emotions behind the injustice, but also how to become proactive, how to become leaders, how to become community activists, how to take a stance, and how to do so in a way that doesn't heap, further aggression or hostility. And so with our program, we have 100% college acceptance rate for all the fellows. Our initial program started with 40 fellows. We're now up to 200 with the third cohort, and going up into maybe 300 or 400 for the next cohort. And we believe that for every young person that we build up, there's sort of this domino effect where they can do that for others in their communities, and really empower individuals so that they're not looking at the world, sort of from the outside looking in, so that they're part of the change, they're part of the solution. So just a lot of building up and encouraging them to be proactive, and to also start to create their own narrative as opposed to the one that's been written for them.
Thank you so much. I think we have time for a couple more questions. I've been seeing, I think, a few questions just around kind of how do we even begin approaching like these conversations, and what are some good conversation starters. I know, Hilda, you may have covered that earlier, but I think folks may have had trouble hearing. So I think one question we had were, what are some ways to motivate youth to get unstuck if they are experiencing mental health symptoms, and motivate them to access treatment? On a similar note, there was another question about just boundaries, of what boundaries should be set when dealing with mental health issues that will allow children to communicate respectfully. So I think along the lines of boundaries, as well as just that initial approach of kind of creating those conversations.
I think that we need to be really honest when we're interacting with young people, and when we don't understand something or don't have the skills or not equipped to manage a particular situation. It's really important for them to see that transparency, where we can say, I hear your pain, I'm here for you, I want to support you, but I'm also going to pull in, some resources and some experts and some people so that we can best meet your needs. So it's really important for the young person not to feel that we've pulled back or abandoned them because we don't understand what they're going through, but more of us almost like modeling what healthy boundaries are like. It's saying, I have my limits, but my limits in terms of my affection for you, my care for you, that's unconditional, and I will pull in all the resources that I can to support you. I think that young people appreciate that sort of honesty, because they know when we're kind of pulling at strings or trying to resolve things without having the proper tools. And I find that they're much more appreciative of the honesty and the concern and the time and energy it takes to pull in other resources, other experts, other services, and potentially have the youth identify what those resources are as well. I always make it clear in my role, even though I'm a mental health professional, that I'm not there as a counselor, but I'm there as a bridge. And I think that sort of reminding them of that role is really important, because it helps, not blur boundaries.
Thank you so much, Hilda. So I think I have one last question here. I'm sorry we weren't able to get to all the questions. But again, we will have the contact information for all the panelists after this. But one last question I wanted to ask all of you, including Annabelle, since you're on our call today as well. Kind of what are kind of the main takeaways from today, or your most meaningful learnings, just given our current reality in the world that we're in?
I think I can chime in on this one. So for me, and I am fortunate enough where I do have a couple of mentors who check in, but I think knowing that their support and that their relationship is consistent even during these times, because we all know they have their own things going on, but just the fact that they're continuously there for you says a lot. And I think Hilda spoke about about being genuine and wanting to give care and not overstepping those boundaries goes a long way, because if we feel that we're being respected, but that we're also being, just checked in on, especially during these times, does go a long way. And it just reminds us that someone's there for us. But I think for me, that's my biggest takeaway is, as a mentor, just remember that we're still here, and the fact that they're checking in and just following up means a lot.
A great answer, Annabelle. I would add to that I'm reminded continuously of how resilient young people are and how capable and adaptable they are. And so as I see, particularly, I'm thinking specifically of the youth that I work with. They were supposed to graduate and they were supposed to celebrate all these milestones that were interrupted, as with many youth around the world. And somehow they found humor, they found other ways to celebrate, they've remained cohesive, or they've been able to reach out when they need support or ask for help or lend a hand to other peers. So I'm just continuously reminded of how sort of elastic they are that way, and how they can kind of bounce back from trials and challenges.
Yeah, and I think the kind of the two things from my end are that we are really thinking about it Up to Us Sports is around coach wellness or mentor wellness during this time, and not, of course, the importance of consistency and authenticity in the ways that they're checking in with their mentees, or in our cases, their players, but also the kind of the types of support that we need for them and need to have in place for them. I also think, just as I spoke to in one of my final slides, I think that there's a huge opportunity for the mentoring community right now to really double down on what we know that works. And that's to what a lot of what Hilda and Annabelle and I have been speaking to today, but what everyone else is doing. And I think just this idea of these second responders, during this time, and I think that's just going to be more and more the case as we move along here. And we're just really grateful to have conveners like Mentor, get people together to share their experiences and lessons learned, because I think we will all be, working together in this next phase. So, yeah.
Okay, so thank you again for joining us. We weren't able to get to all the questions today, but we do have our panelist information here. They were kind enough to share it, so please feel free to reach out if you do have any additional questions. Again, the webinar will be shared, so you'll be able to access this again once it is shared. I did want to go ahead and say, as we close out today's webinar, we did want to share with you Mentor's dedicated webpage in response to coronavirus. So it includes tips for mentors on how to connect with young people, and our resources for leveraging text-based messaging practices, as well as e-mentoring resources, including our EEPM supplement for programs who already leverage e-mentoring fully or as part of a hybrid approach with in-person meetings. It also has information on virtual mentoring portals, mentors advocacy and policy response, FAQs that highlight some of our organizational responses, as well as a curated list of resources and tools that they're finding for mentors, moments, and families, and then their entire mentor network is here to help. So please reach out to them at their national office or at your local mentor affiliate to leverage technical assistance. And then we also wanted to pass along some resources for you, all located on the slide. And some of these documents can also be found in the handout section of the control panel from Mentor and on the NMRC, specifically focused on trauma and mentoring youth experiencing mental health challenges. So again, these are additional resources as mentor skills impact by developing and supporting a national network of affiliates. Mentor affiliates work on a statewide level and serve a unique role as a clearinghouse for training, resources, public awareness, and advocacy. So we do encourage you to find whether you have an affiliate in your region and connect with them to learn more about local resources as well as training opportunities. Additionally, we do encourage you to register your program with the Mentoring Connector. It's a national database of mentoring programs. So this zip code searchable database allows mentors and mentees from across the country to find your program and is connected to LinkedIn, NBA Cares, mentor.gov, and so many other avenues of free program promotion. And then finally, please check out the OJJBP National Mentoring Resource Center website for no-cost mentoring resources to help you apply evidence-based mentoring practices to your program. The OJJBP NMRC provides evidence reviews on mentoring models and mentoring for special populations, implementation resources reviewed by the NMRC Research Board, and the opportunity to request no training or technical assistance. And so again, as a reminder, 1 week after the webinar, all attendees will receive an email with a link to CMWS webpage where they will post a recording, the slides, and additional resources. And so again, also at the end of today's webinar, please answer the short survey so we can help make these series even better. And then be sure to visit the CMWS page on the Mentor website for an archive of all past webinars and information about upcoming webinars so you can go ahead and stay connected. We do invite you to join us next month on Thursday, June 18th for our next webinar on mentoring youth in the transition from foster care to adult life. Thank you again for joining us today, and please be sure to stay well and take care.